Recognizing the high incidence of breast cancer on Long Island, Mather Hospital opened the Fortunato Breast Health Center. As one of the first dedicated breast centers in the region, the goal was and is today to provide a safe, comforting, and uniquely qualified screening environment with a focus on supporting each patient's needs and well-being.
I was approached by the chairman of the board to ask if I had any insight as to what we could do to make the hospital better for the community. And between both of us, we brainstormed and said that maybe a breast center would be an option that we could look into. And one thing led to another, and we started the breast center. The issue of breast cancer is important to me because it's so prevalent here on the island. And since I started the center, I felt that I should just continue my crusade to help women.
The Fortunato Breast Health Center is also committed to advanced proven screening and diagnostic technologies, from digital mammography to fine needle biopsies, which are critical in the detection of cancer in its earliest, most treatable stages.
The Fortunato Breast Health Center's vision for care has always been about the patient. It's about having the patient being comfortable in what's going on when they have their mammogram, they have their ultrasound, they have their MRI, and also to feel comfortable when they left that they're confident in the information we've given them, that they understand the information we've given them, and to know that once they leave, if they're uncomfortable, they could come back, they could call, they could get someone on the phone to explain it to them.
I am a person with severe white coat syndrome, and I'm one of the gals that would put off a mammography. So every year, yes, I do go when I walk in, and the anxiety begins, but the atmosphere is so warm and cordial that you begin to relax. And everyone on the staff there is so helpful and loving, actually.
As a leader in best practices in breast health, the center has long advocated that women with dense breasts have both a mammogram and ultrasound.
We always saw the importance of having ultrasound correlate with mammography at the Fortunato Breast Center. We started doing ultrasound examinations on dense breasts way before the curve.
Fortunato's physicians are expert in diagnosing breast cancer, in large part because they only read breast images, more than 14,000 a year.
A major advantage for a woman to have her breast imaging studies done at a breast center is that the staff, from the technologist especially to the doctors, we really limit our focus to the performing and the interpretation of breast imaging studies. In that situation, we really are able to become experts in our field.
The care at Fortunato starts with the mammography. If the findings are positive, the care is elevated to support and assist each patient through the complex series of procedures and treatment that patient is going to require.
We help them understand, as well as their family, understand what the diagnosis of breast cancer means in 2013. People have ideas of what happened 20 and 30 years ago to family members. That doesn't happen anymore. So that's our job, is to help them understand their diagnosis today and where they're going to be 5 years from now.
And with the nurse navigator, she will help you make all of your appointments. If you need a breast MRI, we'll make that appointment. We would assist you in making an appointment with a breast surgeon or an oncologist as needed, and you're really not left out on your own trying to figure out what needs to be done. The nurse navigator also is a wonderful resource, providing education, emotional support, and we really develop very strong relationships with our patients in this difficult time.
The Fortunato team kept in touch with me and made sure that I was doing okay, and they gave me their phone numbers if anything went wrong, if I needed to just talk or cry. They were beyond. They were beyond, I just can't say enough about them.
Providing each patient with an outlet of support through groups and sharing with other patients is also vital to the recovery of each patient.
Fortunato Breast Center offers emotional support to patients who have been newly diagnosed with a newly diagnosed support group meeting. And then down the road, we also offer a support group for Live, Love, and Laugh Again patients who have been diagnosed and have gone through treatment and continue their support.
The support group was something that I never thought I would want to be a part of, because I'm strong. I could do this on my own. When I walked into that room the very first night, I felt like this is where I had to be.
Support elevates to celebration with Mather's annual Breast Cancer Victory Day in September.
The very first Victory Day I attended 12 years ago, oh, maybe it was 13, it might have been that year. There was a woman who got up, and here I am, bald, fat, wearing a hat, decorated like, you know, a princess, and thinking I'm the only person who's going through this. And of course I knew I wasn't, because we were already started the support group. And a woman who came on the bus stood up and started talking about how she has had cancer 5 or 6 times, but she's here 30 years later. And I'm like, are you kidding? And I'm worried about 3 or 4 months of me. That's going to be me someday. And I'm halfway there.
It wasn't all easy. But as again, the Fortunato Breast Center, definitely, my goodness, I can't imagine anybody being better than them. They were wonderful. Thank God for them.